is the total amount that we're getting, which is a substantial amount of money that we have to spend by June 30th. So it's $319,000. Shows how we're going to be spending that money. So most of it is going towards personnel, but not towards our personnel. Because this is a Department of Behavioral Health grant, it goes towards services that are funded by the Department of Behavioral Health. So we're going to be actually paying the salaries for folks at the Madeline Center and also at Life Push, which is the organization that does our alternative suspension center. And so we're going to be paying salaries for them to expand their services in our schools. We also have a little bit of that going to a grant administrator to cover our costs. So that is some money staying here in Amherst County Public Schools. So what we'll be doing is working on awareness and training. And the first thing I'm going to talk about is signs of suicide. And this is an evidence-based model to just make people aware of what to look out for when somebody might be thinking about suicide or suffering from depression. So we are going to work with the Madeline Center to push this out, and we're also partnering with some of the psychology students at Sweetbriar. They're going to go into classrooms later this year. I'm working with Mr. Crawford to kind of figure out which classrooms. It's not going to be every classroom. We're going to get consent. We're going to do all the things before we do it. But later this year, we're going to push into some classrooms, and we're going to do a lesson on signs of suicide and kind of pilot this and see how it goes. As part of that, there is a depression screener that will be sent home to parents so they know what their child is going to be seeing. Here are some of the things we're doing. The first thing I'm going to talk about is universal screening, and you actually have at your place a copy of our draft universal screener. We've been working on this for quite some time with our mental health team. This is not something that just came up from this grant. It's probably about 3 years in the making now. The universal screener is, the questions are there for you to kind of see what we're going to do. There is some feedback that we're getting on that, so the questions will change before it goes out. And what we're trying to get from that information is how to allocate our resources in the future. We hope to continue to apply for this grant and continue to get it in the future, so that information will tell us where our students are having deficits in their social skills or in their self-efficacy or whatever the case may be, and then we can push those resources to kind of target those areas, or maybe even in certain grade levels, whatever our data shows. We're going to have partner with Al-Anon to have a support group here at the high school. Al-Anon is for students who have alcoholism in their families or impacted by alcoholism or substance abuse, so that is completely voluntary. It's going to be an outside organization that'll take care of that, but we're just going to make it available to our students who want high school. So they're actually, this has already started. They have a person who is there full-time now, doing social skills and working with the kids who are sent to ISD at the high school every day. So that's a really great thing. The Madeline Center will expand their school-based mental health services. This includes substance abuse services, vaping services, outpatient therapy, and then school-based mental health services. They're also going to do some mental health and substance abuse screening for just students who want that or parents who are referring their students for that.